cyst under here. From this, Betty? Okay, you shouldn't feel anything, like I said, other than my touching you here. So you're retired these days, huh?
Yes.
What do you like to do in your spare time then these days?
Play golf.
Ah, what do you play?
Out at Sierra Laverne.
Okay. Do they have a membership there? They do, right?
Yes.
Sierra Laverne, that's right. I think I've played there before.
Are you a golfer already?
I am. I kind of more used to be as of late, actually. We just quit the club recently, and that we used to be members of Red Hill.
Mm-hmm.
But it's just we don't have enough time right now. You know, I got two young kids. I'm gonna squeeze this, okay? It shouldn't hurt you at all. But I do think this is a cyst. Actually, one down this is not me. Two. Because I think there we go. See you go. Hold on. Don't do anything. I'm gonna squeeze it, okay? Lower. I gotta get my hands around it. There we go. Gonna squeeze your little cyst. You're not hurting it, right?
Mm.
So a cyst is like it's just like a little sac under your skin where skin collects into it, probably flakes into it.
Mm.
So
what causes it?
We don't really know. I think more people that have acne maybe are a little more prone to it, prone to developing them. Hold on, I'm just gonna put a little numbing on it there, just in case, because we only numb the surface, and I don't want you to feel anything later, so. Let me just put some underneath there a moment so I can feel like let me see if I can get that all out here. Pull up here too, Betty. Okay. So it's like a little sac, like I said, that flakes under the skin, and if you don't get out the entire sac, it can have a chance of recurring. So I'm just trying to make sure I get it all. But this sac is really, yours is a little bit broken down. I can't really feel all of it. I'm just gonna investigate here. The sac wall here. This looks like scar tissue. You're right there, huh?
Mm.
Okay. That's a little bit of the contents here. I just have to pull around and make sure I get everything. I'm gonna take off that little bit right there, actually. Okay. Just relax. Just want to see it for a second. Yeah, let me just take off this a little bit here. Sorry about the snipping sound, but a little scarred down, I think. Looks pretty good. This is lower end. Almost
Looks good.
Yeah, let me just check that. There's a little bit of whiteness down here. I see it. It's like this is one of those cysts that's under the radar a little bit, and I think there's. Just want to make sure that's not actually sac wall right there. Instead of scar tissue. Let me see. There's like a whitish kind of maybe sac wall here, so if I disrupt it, at least I know it's not going to come back there. Go like this, push the back of that corner, see how it's white underneath there?
Yeah, I see.
That's what I'm trying to make sure I get all of. I think that's still a little bit of it right here. Just tough to grab. Let me just see if I can buzz it a little bit. That looks pretty good actually. That's more yellow here. Let me see. Okay, look for just a minute. Yeah, that's yellow. Alright, I think I did get it all. That looks more like just scar tissue here. This part's just more yellow. Let me just do a double check here. Sorry, I'm mumbling to myself. I hope you don't mind, I know. Just trying to make sure I get it all. Yeah, see, that's yellow. It's okay. Let's go on this side here and see. Good. Okay. Okay. One more look. I always have to do that one last look. Scar tissue. Good. Good. Okay. Let's stitch in there. And let's hope it doesn't come back. I think we got it all, but
Okay.
you never can be too sure if it doesn't come out in one full piece. But
They have a
it's pretty
tendency-
darn good.
They have a tendency to come back.
It's sort of like, I kind of compare it to like if you have when you cut off a worm's tail, you know, like if a part of it's still there, there's a chance it could come back. But it looks pretty good. I did a pretty good look over. Look, see here. You can move over closer to me if you need to. And it looks pretty darn good. You know, I just made sure there's sort of like scar tissue, or just firm, kind of our muscles and our everything around here is a little bit more firm. So I just have to pull on it and see whether it looks like it's gonna come free. If it would more so if it was the sac wall. So it looks pretty good. I'm pretty confident. I definitely gave it a thorough look over, so. All right, we've done in like 2 minutes here.
Okay.
So you're gonna come back in 1 week to take out these sutures.
Okay.
Put interrupteds in there.
Don't get this wet tonight.
No, you could, well, I'd rather you take a shower tomorrow.
Okay.
And getting it wet tomorrow, which you can certainly do. If worst came to worst, you could probably get it wet tonight, but I'd prefer you leave the bandage.
Just don't get this wet. I'm gonna take a shower, but I don't have to do much.
Oh, I'm sorry. Yeah, avoid getting this wet for just overnight.
Okay.
Tomorrow you can probably take a shower again and get it wet.
Right.
But I would just wait at least overnight, I'd say. I like to wait like almost 24 hours or 12 hours at least, I guess. Let me just make sure it's nice and flat. Just right here with my hand, clean it off. Good. Okay. All right. She's gonna put a bandage on it. That's it. Thank you.